Welcome back to the show, Talk with your Doc. And with me is Dr. Sanjay Azad, and we are talking about melanoma. We just talked about how can we diagnose melanoma at earlier stage by doing regular self-examination, noting the change in the dimensions of a pigmented lesion on your body, if it increases in size or color. And I, as a patient, come to you. So what do you do the next once you find a lesion is abnormal?
Well, you go through, a full consult and, check on the patient's medical history and allergies and any medications which can affect, the treatment. So once you've evaluated the patient, fully in a clinical sense, then the next step is to typically look at the lesion, and it looks suspicious, then we want to do a biopsy.
Mm-hmm.
So for a dark pigmented lesion, more often than not, you want to take the whole lesion out if possible. Let's say the lesion is very big, then you may have to just take small little pieces from different areas.
So that is to diagnose it just?
There's just a diagnostic biopsy, and you only take a very little amount of skin all around it, and you send it off for evaluation.
Right. So that is called excisional biopsy or punch biopsy also you might send. How about lymph nodes? Do you ever evaluate the lymph node biopsies?
So lymph node biopsy is a more recent thing. It is becoming more and more common depending on the melanoma itself and the stage of the disease. But the lymph node may have to be biopsied, but it is typically done, by injecting some kind of locator dye to find the lymph node which may be involved. So
that you call it as a sentinel lymph node biopsy probably?
Correct.
Right. Not all the patients get sentinel lymph node biopsy probably, right?
No, so it depends. So when patients come to me, I do the excisional biopsy or do the treatment for them, and then send them to the cancer center, and then they will be evaluated, and then only for the very specific patients who are in a more advanced stage will they require a sentinel lymph node biopsy.
So once you take a biopsy, then biopsy will come to a pathologist like myself at the hospital, and then we evaluate the biopsy. We diagnose whether it is a melanoma or not, and if it is a melanoma, then we'll say what type of melanoma it is. We will measure the depth of the melanoma, the thickness of the melanoma, and we stage the melanoma depending upon the stage, the mitotic index, the ulceration, and all other parameters. So can you please tell us about what other staging investigations do you do in addition to the pathology report?
So apart from the biopsy itself, you can do some blood tests. Particularly, you can do some liver tests, which may suggest that the disease is more advanced, and of course we can do scans.
Okay, radiological investigation. So
correct.
Chest X-ray, PET scan, or MRI.
Absolutely.
Or sometimes you do CT scan guided biopsies also of the lymph nodes, and you evaluate whether the lymph nodes or the metastatic organ has been involved by the malignant tumor, and then you stage the whole melanoma. Now once the staging is done, what are the survival chances or survival statistics for different stages like stage 1, 2, 3, 4 melanoma? So this TNM staging, so what are the survival rates?
So if the melanoma is very early, let's say the melanoma has not gone beyond the very top layers of the skin, and that's called a melanoma in situ.
Right.
So in that situation, there's no problem with survival at all. The survival is normal.
It's a curable.
It's a curable condition for sure.
Right.
Then if it's, let's say a patient is being diagnosed with all evaluation as stage 1, then you're looking at about 90% survival plus, for 5 years.
5 years.
Then it goes down as you go down to stage 2 and stage 3. Stage 4, of course, is a more advanced condition which is spread to other organs, and then the survival is very poor.
So stage in situ melanoma is curable. Stage 1 or 2 has a good survival, and as you go towards stage 3 or 4, then the 5-year survival is less.
Yes.
So what are the treatment options for stage 1, 2 or earlier stage of melanoma, and what are the treatment options for late stage of melanoma?
So the primary treatment of the melanoma is surgery.
Okay.
And
All
of
the
course,
melanomas are treated with a surgery.
surgery. And then there are other treatments for any sort of cancer,
Yeah.
which rest on things like medications, chemotherapy, or radiation treatment.
Yeah.
And there are some other experimental treatments
Right.
with vaccines.
So for the surgery, please tell us about what are the different types of surgeries you do in the melanoma case.
So for a melanoma, let's say the melanoma is an early melanoma, there are some described margins of removal. So when you've had a biopsy, only a very small area of tissue is taken out. But when you do a formal treatment for a melanoma, you remove more skin around the tumor. So you want to go deeper as well as on the side. So what you do is what we call as a wide excision of the tumor. So you remove it completely, and then once you've done that, then some form of reconstruction is required for the area because the removal is quite large. So then you have to do either local flaps, which is like tissues are mobilized to close the big area, or we can use skin grafts.
So you remove the tumor, which is a pigmented cancer melanoma, with normal skin tissue around it.
Correct.
Making sure it is completely excised and it does not come back.
Absolutely. So that's those treatments have been described through lots and lots of studies which have been done over the years, and you basically follow the guidelines and then remove the tumor accordingly.
Right. Now, you mentioned about other options. So surgery is the common treatment for all, and then there are other options like radiation you mentioned, and then there possibility of immunotherapy or targeted therapy also. So do you use the radiations for all the patients or for certain patients?
So no, they're not used for all the patients, but they'll be only based on specific patients, specific criteria, and this is all discussed in an environment of the cancer center. And we've got a big cancer center in Ontario at Thunder Bay Regional, and then it's discussed with all the specialists present, and a decision made whether it's appropriate for the patient or not.
Right.
So it's all the medical history and the melanoma, along with any lymph glands involvement, all those things are taken into account as well.
So there are new advances in the treatment like immunotherapy. These are the treatments which increase the immunity of the patient to fight against the cancer cells. And there are new treatments like targeted therapy, which are different than the chemotherapy, where in the targeted therapy, they do the testing for BRAF mutation study, and this targeted drugs are targeted towards those patients with this BRAF mutation positive patients. So all those increase the survival of the patients with the cancer, and the survival chances of the patients even in the late stage has been improved with the new updates in the treatment. Do you want to add anything to that?
Yeah, I mean, certainly there's a lot of research going on because melanoma has been a big bugbear for us. So all these new therapies are coming in. They still need to be evaluated fully,
Right.
and the response rates are improving, and we've just got to bide our time and see how things fare out.
Thank you, Dr. Azad. That's very helpful. Thank you for your time. Thank you, viewers, for watching the show Talk with Your Doc. Please join us for the next show where we are going to talk about cervical cancer. Thank you.